Welcome to the Politics Chicks podcast. I'm Christy Branham.
And I'm Monica Healy.
Today's guest is someone who has had an extraordinary impact on my life personally. Dr. Patrick Hadorn isn't just an exceptional physician, he's my primary care doctor. As many of our listeners know, I live with multiple chronic illnesses, and I truly wouldn't be sitting behind this microphone today if it weren't for the incredible medical team that's helped me regain so much of my life. Dr. Hadorn has been one of the most important members of that team. He's helped me navigate complicated diagnoses, coordinated my care, and has always treated me as a whole person instead of a collection of symptoms. The fact that I continue to be a part of the Politics Chicks is due in no small part to his care. We wanted to invite Dr. Hadorn on not because he's my physician, but because every patient deserves a doctor who listens, partners with patients, values evidence, and understands that trust is the foundation of good medicine.
Healthcare touches every family. Whether you're managing a chronic illness, raising children, caring for aging parents, or simply trying to make sense of the endless stream of medical information online, today's conversation is for you. Dr. Hadorn, we're so glad you're here. Welcome to the Politics Chicks podcast.
Yeah, thank you for having me. And Christy, thanks for the incredibly kind words. It's been a privilege being involved in your care, and it's just a reminder of why I do what I do.
Just an aside, Dr. Hadorn just doesn't see me. He is the primary care doctor for my entire family. So he sees my husband and my kids as well. So he's kind of he's got the whole Branham family as his patients.
That's the best part of primary care.
Christy knows you well, but let's introduce you to our listeners. Let's start with your story. Tell us a little bit about where you grew up, what first inspired you to become a physician.
Yeah, so I grew up in northern Kentucky, kind of just south of Cincinnati, across the Ohio River, where my family still lives, and moved here to Minnesota in 2015 after I finished residency at the University of Kentucky. Kind of did all my undergrad and training down in Kentucky, and then met what would be my future wife down there, and we moved up here in 2015. I've been practicing, primary care since then, and just really enjoying Minnesota, winters aside, and
yeah,
that's fair.
It's been great.
Well, and you trained in both internal medicine and pediatrics, which is a unique path that allows you to care for patients throughout every stage of their life. What drew you to both those specialties?
Right. Yeah. So I didn't even know that was like an option when I started medical school. I originally thought I wanted to do pediatrics. I grew up in a big family, extended family, and just always enjoyed working with kids through college. And so I thought pediatrics. And then when I was going through my rotations in medical school, I met a doctor who was med peds, as we call it, internal med and pediatrics. And I thought that was some kind of anomaly. I'm like, oh, were you just over ambitious? Did you just decide to double board in these things? And they were like, no, this is an actual residency you can do. And so I started looking into that. And then as I did more kind of internal med rotations, I realized, I really like kind of complex adult care as well. And so when the time came to choose, that's what I picked. And a lot of us med peds docs, which there are a bunch of them in my practice as well, we're kind of indecisive, so we were like, we could do this or that, or we could just do it all. And those of us that then go into primary care, I feel like it's even more of just, we just never wanted to specialize. We realized we kind of liked, as you said, treating birth to all the way through the lifespan. And that has been the most rewarding part of my practice, is just, going from a 6-month-old well child, say, to the next patient's, 85-year-old Medicare annual wellness or chronic disease management. I think it's really been kind of exactly what I hoped for.
You want to talk a little bit about that evolution? You are at Park Nicollet in Maple Grove, and Christy and I are both in Maple Grove. Mm-hmm. And, from medical director caring for newborns at Maple Grove Hospital, what does the evolution of the last decade look like?
Yeah, so the first 5 years, I've been there for, I guess, 11 now, it's hard to believe, but the first 5 years of that, it was just all focusing on building my practice, patient care, clinical care. And then around 2020, right, just before the pandemic, our previous medical director decided to step down, focus on other things, and they started sort of looking to see if anyone had any interest in filling that role. And initially, I did not. I really didn't go into it thinking I would ever get involved in leadership, but I would say in a way it kind of fell in my lap. I applied for it, I got the spot, and I've been doing that ever since. So I have probably about 25% of my practice is administrative medical director stuff, and then the rest is still clinical care, and I do newborn nursery rounding at the hospital as well.
That is a really broad range of interests.
Yeah.
And, when we talked to you about coming on the show, I asked you to kind of list a couple of your areas of interest in medicine. And what you said was preventative medicine, chronic disease management, maternal child health, mental health, leadership, and advocacy. What is it about primary care that inspires you to continue in your profession?
Yeah, I think it's the relationships, both with patients and colleagues. That's the thing that kind of is the backbone of it, and that kind of keeps us coming back. It's what I love most about my job. And getting to see that kind of longitudinally develop over the years. I now have 10-year-old kids in my practice that I saw in the newborn nursery, and that's just so rewarding. And then I think also in primary care, you never get bored because you're seeing a little bit of everything. I mean, like I said, you any given day you could see such a variety of things, and that variety keeps it from getting old and stale. And then the medical director piece of it, one of the surprising benefits of that for me personally has been that when I started it, as I mentioned, I was about 5 years into my practice, and I was already starting to feel a little bit of like just hints of burnout at that point. Now, granted, this was even pre-COVID, so take that with a grain of salt. And so the medical director piece it was a little bit of like a relief valve on not only could I kind of see sort of the inner workings of healthcare and our organization, but it allowed me a chance to get to know some of my colleagues better, because now I'm doing their annual reviews. I spend more time rounding throughout the day, talking to them. And since we're a big clinic, that's not something that I kind of had before that. I mean, I knew everybody's name and everything, but you don't get to know them on that same personal level. And I've had to deal with a lot of challenges in that role, but also, again, it's kind of given me a greater respect for the complexity of healthcare and how we get paid and the insurance companies, all the other stuff we'll probably talk about a little bit later.
So let's step away from the exam room a little bit and tell us about you. What do you do to recharge and enjoy life?
Great question. Yeah, because you need that. Well, I would say number one is, spending time with the kids. I have 2 daughters, and we like to travel. We like to go to all the local parks. Of course, they're getting a little older now, so I'm less cool to them than I used to be. I got a teenager now. But no, we just like to explore, and we like to hang out. And I also love to read. I'm always reading. I love to play music and go to concerts and spend time outside when I can. So that's kind of what you'll find me doing when I'm not in the office.
What's the last concert you went to?
The last one I went to would have been a band called The Maine. They're kind of I don't know, I wouldn't say pop punk, but they're kind of in that space, alternative punk kind of. I saw them at First Ave back in April, I think it was.
Nice.
Oh my God, you and Tom have so much in common. It's not even funny. Did you know his family grew up, his dad is from Falmouth, Kentucky, which is Rackham County.
Yeah, I know exactly what's that. Yeah.
Yeah, so he grew up, his family is from right where you grew up, and he is totally a punk ska guy.
Yeah.
So that's his jam.
I was in a band. I was in a band like that back in my sort of high school, early college days. Yeah.
Yeah, that's probably why he likes you so much.
We have that
Subconsciously, you're
connection.
connected. Yeah. And you started practicing medicine just a few years before COVID fundamentally changed healthcare. And looking back, how has the profession changed? Because it totally turned medicine on its head, right?
Yeah.
First of all, introducing telemedicine, which we could never do before. So go into that a little bit for us.
Yeah, that's probably one of the biggest changes is like overnight, in order to survive as an organization, well, not just our organization, but across the board. I mean, you had these shutdowns, we had to switch to telemedicine, and it was being done in smaller ways prior to that, but 100% virtual care for a little period of time there. And then even after that, that's kind of persisted. So that was a huge transition. I remember the first sort of video visit I did, I was nervous, I was like, gosh, I've never done this. And the patient, I didn't know how it was going to go. And quickly we realized like, oh, this is actually like a viable way to do healthcare for certain situations. And Christy, well, like you and I have done the vast majority of our care virtually over the past few years. So that was big. And I think also, there's been silver linings like that have come out of it, but from a maybe less positive standpoint is with COVID and the subsequent years, there was sort of a diminishing of the trust between a lot of patients and healthcare providers, the vaccine issue and just in general, I think there's a lot of misinformation that came out of COVID. And so, which again led to sort of a lot of downstream burnout and people leaving the profession and things like that. But I think probably the biggest change, was just in the delivery of care and realizing that it doesn't have to be just a brick and mortar seeing your patient in the exam room situation. And that was a positive, honestly.
Well, let's delve into the pandemic a little bit more because it affected everyone in every aspect of their lives. And I was a public school teacher, and I cannot tell you how awful that was to try and teach virtually. But healthcare workers, that was another level. So what would you like people to understand about that time frame of being in healthcare during the pandemic?
Yeah, I think just the healthcare providers, it was unknown territory for us too. We were all just trying to do our best. The amount of information, the pace of new information, new developments was it was like drinking from a fire hose. So we were trying to keep up. We were trying to do our best in a brand new sort of unheard of type of scenario. And I think the majority of people kind of understand that, but there was just, more pockets of people there was a lot of distrust. Remember the early days of the pandemic, there was all this sort of outpouring of support for frontline workers and healthcare workers, and that was really great. But then you sort of saw as things went on over time, it was almost like it did a 180, and there were people that kind of saw a lot of healthcare as the bad guy, or you started seeing people kind of going more to these sort of alternative practitioners and things like that. So I think
Dr. YouTube.
Yeah. Dr. Google, Dr. YouTube, ChatGPT, you name it. Yeah.
And physician burnout has become a major concern, right? Because to do research for this episode, I just looked, and there is a sharp decline in the number of people electing to go to medical school, whether that is because of the exorbitant costs or, maybe it's a result of COVID. We're not quite sure, but burnout is a major concern. And why are so many talented clinicians leaving the profession? And where is that going to leave us when we have less doctors coming down the pipeline and more practitioners leaving?
Yeah, it's very concerning, even in our group, which we generally have been fortunate to have a lot of new applicants and clinician interviews over the years. Even we're seeing a decline, mainly interestingly, in kind of more in the physicians. I think there's still a pretty good pipeline of what we call APCs, nurse practitioners, PAs, but there's not that many physicians or residents that are going into the primary care. And as you mentioned, there's a lot that are leaving prematurely. We have people that are retiring in their 50s that were planning to work, till 65. And I think that's for a variety of reasons. I think it has to do with the increased documentation requirements, things like prior authorizations and insurance denials, and just all of the things that take away from that direct patient care that we went into it for. I think that could be an entire podcast episode right there, but I think the short answer is, there's fewer people going into it. There's more leaving. And so if we don't do something to sort of stem that loss, we're looking at a pretty bleak future for primary care.
Yeah.
We're all in a fairly major metropolitan area, and what are you hearing about what's happening in rural areas?
Yeah, I mean, just multiply what I just said by, whatever factor. It's even worse. I think a lot of new grads are really hesitant to practice in rural settings because of the lack of support, which is not new for rural primary care, but I think that's kind of just been amplified in recent years. You see a lot of the cuts that have come to funding that are affecting rural hospitals. Hospitals are closing down, and there's a lack of specialty care in rural areas. So these patients are having to drive hours sometimes or more to see a diabetes specialist, for example. And so these primary care doctors in the rural setting are having to manage things that they really weren't trained for. And that, again, kind of just factors into the burnout. They probably have to see more patients per day than I do in a suburban setting. And so it's not very enticing for a new clinician or a seasoned clinician. I mean, there's a lot of great things about practicing rural medicine. I mean, I think you become even more a part of the community, and it's very rewarding. We had to do rural rotations in medical school, and I really liked that. But when the time came to decide, I was like, I want to go to a place where I have more support and have more access and things to specialties. So
I just saw on MS Now this weekend, they were talking about healthcare crisis. And in Iowa, people have to drive 200 miles to see an OBGYN. because there are no OBGYNs in Iowa. Literally, people have to drive to the University of Iowa to deliver their babies. And for people with complicated pregnancies, I just can't even imagine having to manage that. I mean, it just is really troubling to hear things like that.
Yeah, I agree. I mean, even in some places in Minnesota, I've read, there was similar up north. I know there's places that are a couple hours from the nearest hospital. A lot of L&D units, OB units have closed down in these smaller hospitals because they just can't afford to keep it open. It's unfortunate.
Lack of access to physical care is going to lead people even more to, as we mentioned, Dr. Google and Dr. YouTube and social media is pervasive. Like people are going on social media to seek out medical advice. And what are you seeing about that in your patients and in your practice, the pervasiveness of misinformation?
Yeah, that's a great question. I see it every day. Every day people come in and maybe they have a list of things that ChatGPT told them when they put in their symptoms, or Dr. Google. And I think it's great that we live in an age where we have that access to information, but the average person doesn't have the training or the ability to sort through some of that and know what's misinformation versus information. And so, what I try to do is go at it with an open mind. I never, I know these people just want what's best. I think of like a parent of a pediatric patient. They're worried about their kids. They come in with information that they saw on Google. And what I try to do is I go through with them. I don't dismiss them. I say, oh, okay, well, this is interesting. Let's go through this. And sometimes, people bring in information that is right on and is accurate. And that's great. I think people should be advocates for their own health care. But again, the downside of that is when, they're convinced they have cancer because of, an isolated lymph node on their neck, and no amount of reassurance that I can try to give them is good enough. And, so that part is frustrating. And I just try to, I will say that is definitely a source of frustration for all of us, not just in primary care, but in medicine in general. And I don't know the perfect solution, but I know that dismissing a patient because they come in with information is not the answer. You got to try to always put yourself in their shoes, and I do it myself, right? We're all guilty of it, right? We all use AI these days, and I think it's kind of the wild west of medicine right now.
Okay, I have to jump in with a little aside, and this predates the internet, but when I was a little kid, my parents had encyclopedias on a bookshelf, and I had a lymph node under my arm that was swollen, and I'm paging through the encyclopedias, and I was convinced I had cancer. I was probably 12 years old.
Yeah.
So you multiply that times, like you said, whatever factor, with all the information available on the internet.
Yeah, it's certainly an added complexity to an already challenging job.
It gives people just enough information to be dangerous, right?
Exactly.
Exactly.
So let's move on to vaccine hesitancy. And that persisted long before the pandemic. All three of my kids are neurodivergent. Two of the three are on the autism spectrum. And I never once hesitated about vaccines. I do remember their pediatrician when they were young, when I asked him about it, said the reason that people are thinking that it's tied to the vaccines is because a lot of times the vaccines are being given at a time when the symptoms become more prevalent and more easily identifiable, because a lot of times these kids are getting boosters when they're 2 or 3 years old. And that's really when you start noticing the neurodivergence stuff if the kids don't have developmental delays, right?
Correct.
So how do you approach conversations with patients who have concerns while maintaining trust? Because with the Secretary of Health, all of the misinformation that's coming out of the Department of Health and Human Services right now, it's devastating, because these kids are being left open to things like measles, and we're seeing a resurgence of tuberculosis and polio.
Yeah.
And so how do you address that as a physician?
Yeah, carefully. I think you try to, again, seek to understand. In my practice, I kind of have, I would say, 2 broad categories of parents that refuse vaccines. One is they've made up their mind from day one, and there's very little you can do, and they kind of get maybe a little defensive and angry if you even sort of bring the topic up. And then the other is more of a open-minded, they have questions, they're kind of taking their time to decide, and maybe most of those in the second category will eventually get some or all of the vaccines, but they maybe want to do an alternative schedule, or they just, they want to have that discussion. And so all of those categories, I mean, I still see all of those those children and parents. And so I try to periodically bring the discussion back up with those parents in the first category, just to say, hey, maybe the last time we discussed it was at the 2-month well visit, and here we are at 6 months, still feeling like you aren't interested in doing any of the vaccines, and why, and is there, any questions you have, and just try to keep that an open discussion. Versus I have had colleagues over the years and attending physicians, and when I was in training, who just kind of have a blanket policy of, you can decide to refuse vaccines and I can refuse to see you as a patient, and they just kick them out of the practice. And there's some people that would say that that's the right approach. As pro-vaccine as I am, I still think these children need to be cared for. They need a pediatrician. And unfortunately, if I don't see them, right, they're likely to end up in a practice that is, even more just kind of an echo chamber, because those are out there. We all know those practices where they kind of are on the other end of the science spectrum.
There are a couple of those in the Twin Cities where there's
the
clinics
of
are
them.
notorious. Yeah.
Yeah. So I think for me, it's just about keeping an open mind, presenting the science, because the science on vaccine safety is, they're one of the most studied healthcare interventions in history. So we've got over a century of data on their safety. And as you mentioned, some of the, the more recent stuff with the health secretary, yes, it's been very frustrating, and that's putting it nicely. But what I have noticed, again, to try to see some silver linings and things, but is that the majority of my patients have come in saying, you guys are sticking with the previous schedule, right? The previous vaccine schedule, right here. And we are. So we as an organization continue to follow the American Academy of Pediatrics, all of the big physician organizations, the family practice, the pediatrics, internal medicine, OBGYN organizations. They all continue to support all of the previous CDC recommendations. And so I think that's good to see these organizations led by physicians that are all banding together and saying, look, this is anti-science. We're going to continue to follow what the science shows us. And so I know it differs by practice. And even within the Twin Cities, as medical director, one of the things that I get to see is all the data on, well, Maple Grove's vaccination rates are this, and Elk Rivers are this, and Andover's, so our whole Northwest region up here, we meet once a month with all the medical directors, and we go over things like quality improvement and vaccine and all this kind of stuff. And so I get to see the different rates, and it's really interesting to see how different it is in, say, Wayzata versus Elk River versus Anoka, you know what I mean?
And you say those words, and we can in our minds know exactly what the vaccination rate is going to be based on those cities.
I realize I'm talking to a wider audience, but yes, even within any area, you're going to see that. Even as you get 20 minutes out into kind of a little more rural, you're going to see a lot of times those vaccine rates drop, things like that. So
how does it feel to feel like you've been hung out to dry by the administration? I mean, I just cannot even imagine the years that you've spent putting into your education. We've got a Health and Human Services secretary who has no medical background whatsoever. He'll read one study, he'll cherry pick information from it, he'll pick studies that aren't even peer reviewed. And for people who don't understand that, a peer reviewed study is something that not only has been written, but peers in that area of specialty have read it, have reviewed it, and have quoted it in their own work because it's valid information. So how does it feel just to be hung out to dry? I just can't even imagine what it must feel like.
It's demoralizing. It's very unnerving. I think we in our profession never thought there would come a day where we were at such odds with our own policymakers, our own government like that. And honestly, the rest of the world, the World Health Organization, you know what I mean? It's, I think we're all just kind of doing the best we can until, fingers crossed, this is, over.
Sooner rather than later, hopefully.
Yeah, this hope that better minds will prevail, and we'll kind of get back to leading the world in terms of our health guidance and our, the basic things like vaccine guidance, which again, you never thought would be under such attack.
Right.
And in this era of misinformation and disinformation, and as Christy pointed out, the Secretary of Health and Human Services having no medical expertise, how do you guide people, like for our listeners, trying to make informed decisions? What are some practical ways to identify credible medical information?
Yeah, great question. I try to guide people to trusted resources. We use a lot of Mayo Clinic, for example, as a trusted resource that I guide people to a lot. Cleveland Clinic, the World Health Organization. The problem with that is that people still, when they Google something, they have to do that extra legwork to kind of determine that. And I think some people, that's not something that the average person might, they think, oh, I Googled it, this is what I saw, this must be right. Or
Right.
increasingly people are relying on social media, which again can be good or bad. But as we all know, it's a bit of an echo chamber there too. And so I think I try to guide them to the sources that I would look up. Like I said, American Academy of Pediatrics, the American College of Physicians, that's our internal medicine organization. But when I am looking up from an AI perspective, when I am looking up data or looking up studies, there's a great site called Open Evidence now. It's mainly created for healthcare professionals, but it's open to the public too. And that is really good at like sorting through, like you said, randomized controlled peer-reviewed studies and things like that. So it gives you, it's probably the most trusted medical version, similar to something like ChatGPT or Copilot.
Well, we'll make sure to put those links in the show notes for people to have. And since you brought up AI, we were going to talk about that a little bit later in the show, but I think it makes sense to talk about it right now. So why don't you explain a little bit on how AI has impacted practice, both from a physician's perspective and also in frontward public facing with patients?
Well, from a physician and patient perspective, it's really kind of, we're witnessing it revolutionizing our practices already. I'll give you a few examples. One is we now use something called ambient dictation, which I'm sure most people are familiar with, but that's where if you've gone into a doctor's appointment in the past few months, you probably have had your physician or your provider get consent to use, ambient dictation, which is basically it listens, it helps transcribe and turn the visit into a nice succinct note. And it takes away some of that time that we previously had to spend typing away. It also cuts down the time that we have to spend after work in cases like mine, where I like to get out of there quickly so I can get home and see the kids. So I probably spend an hour less per day, honestly, because of that. It's also been, and that's just more of a practical kind of administrative use of it. And we're also seeing it become more and more sort of mixed in with clinical decision making. And it's still kind of in its infancy with that. I think we're still figuring out how best to use that and what's the right way to use that ethically. But even now, if I were to type in, I have a 2-year-old with fever and swollen lymph nodes, what are some of the things I should be considering? It'll give you a list of things. And again, it's not making that decision for you or telling you exactly what to order, but it's reminding you of some things that you may not have considered when you have to keep a million different things in your brain every day. So I think we're seeing it really revolutionize care in that way. From a patient standpoint, similar. I think, as I touched on earlier, patients are putting their symptoms into ChatGPT. It's spitting out who knows what. Some of those might be a likely diagnosis, but oftentimes, the C word, cancer, is going to be on there somewhere. So people are coming in kind of worried and freaking out that they have the worst thing on that list of potential diagnoses. And so that's where I think there's always going to be that need to interpret those findings and have that expertise, because I can look at that right away and put it into context with lab findings or imaging findings and say, oh no, this isn't cancer, this is XYZ. So that's just for more of a clinical sort of symptom based, but then you're seeing it used with some online applications like MyChart, which everybody's familiar with, right? A lot of the big organizations use the same Epic system, which has MyChart. So AI is being used with that. Gosh, the list goes on and on.
It's being used by insurance companies to make decisions about covering treatment. So let's talk about that elephant in the room.
There's the dark side. Yes, that is probably the number one sort of bane of my existence in my practice. We're getting insurance denials left and right, and this isn't one specific insurance company. It's really across the board. But yeah, you're seeing a lot of where previously, let's say I ordered an MRI, and I might get a denial and have to submit a prior authorization because they say, well, you shouldn't have gone straight to an MRI of the shoulder. We need to see an X-ray first. Well, me as the clinician knows that an X-ray would not have been helpful in this situation. So that's why I jumped to doing a more advanced imaging. Well, that used to be something where in the worst case scenario, we would have to do what's called a peer-to-peer, right? So I might have to pick up the phone during my busy day and call this this utilization review physician with fill in the blank insurance company. And
Yeah.
the majority of the time when you talk to the human on the other end, they'd say, okay, that makes sense. We'll approve it. And yes, that process is frustrating, but at least there was a human involved. Now it's like, I can't tell you how many times there's a denial, and it gets to the point where we submit an appeal letter and you can tell that this is all AI driven, and it gets denied and there's nothing you can do. Either you tell the patient, well, this isn't going to be paid for. Your options are, we can pay out of pocket. We can try an alternative test that's inferior. It's very frustrating because I, as their clinician, know what's best for whatever the scenario is. And yet there's this middleman, this constant elephant in the room, as you said, and now we have to talk. We have to talk about it. And that's not something that I went into medicine for. I didn't go into medicine to have discussions about insurance during your 30-minute physical, or discussions about, well, I'm going to prescribe this GLP-1 for you, but just so you know, it's going to get denied. We're going to have to go through a prior authorization process, which we'll do. We have an entire team now that works these things, which gets into
I had to go through that process with you. And I remember my prior authorization number got held up for 2 months because they were backed up with GLP
I do remember
things.
That.
Yep. Yeah.
We've literally hired extra people just to work on prior authorizations. So that, again, is this really saving anybody any money? Well, no, it's not. It's adding to the cost of care.
This will be the elephant in the room for quite a while going forward as the world figures out how to navigate a world of AI. But as you look over the next decade, what's giving you hope about the future of medicine?
Yeah, I think that if used correctly, and I'm not going to claim to know exactly what that looks like, but I think if used correctly, AI has a ton of potential. I don't think there's any use in fighting it, because it's here and it's not going away. And players involved with this need to find out how to use it appropriately. But I think it gives me hope for things like, the big obvious ones are cancer treatment. I think we're going to see more and more uses in oncology where you can see treatments tailored to a specific individual, as opposed to kind of the old, let's throw these broad chemotherapy drugs at it that are going to kill the cancer, but they're also going to wreak havoc on your healthy tissue and cause all kinds of downstream side effects. I think you're going to see a lot of targeted therapies that are going to be coming out for diseases that we thought were just kind of insurmountable, right? I mean, I think you're going to see things like pancreatic cancer in coming years be more treatable and increase survival for things like that, and maybe rare diseases too, because AI, and you think of it, it has the entire database and the entire world at its fingertips, and no human mind can compete with that. So I think it has a ton of potential in that world. And I think even within primary care, if we use it correctly, if we use it with the patient and not, look at it as this enemy, I think it has great potential. I'm excited about it. I'm also weary of just like the things I mentioned. I think more and more people have a trust issue, and they feel like, well, I can get my answers online, and they kind of come in wanting sort of a la carte. Well, it said you should order this test, and this test. And if I don't, as their doctor, order those tests, well, you know what? We get scored. We get these patient experience scores, all, you know what I mean? So there's all these different factors in there. And so I think we have to find a way from the public-facing side to better educate people on how to use AI and how to work with their healthcare professional, as opposed to seeing us as simply, someone to, order what they want.
Yeah. And Dr. Hadorn, you've walked through some pretty difficult years with me the past few years, and you have seen what happens when patients have a physician who believes in them, listens, and refuses to give up. Because I'm not going to lie, I'm a complicated case. There are probably plenty of times where I've heard that when you're a doctor, if you hear hoofbeats, you shouldn't look for horses, you should look for zebras, right? Is that a thing?
Yeah, that is a thing. Yeah, we often talk about, use that analogy of the zebra, right? Because it's...
Well, I've been a zebra for you, and it's taken a long time for you to really, and the other members of my healthcare team, to really come to figuring out what's wrong with me and then coming up with a treatment plan going forward. And for me, it's not a matter of curing what I have. Unfortunately, it's chronic, and it's going to be managing that over time. So I see you once a month on a regular basis to touch touch base, see how I'm doing. And what does it mean when we talk about the relationship between a primary care doctor and someone living with chronic illness? How does that relationship grow, and why is that trust so important both for the doctor and for the patient? Because there has to be a trust both ways, correct?
Correct. Yeah. Trust is what it's built on. And this is why having that sort of stable long-term relationship with the same provider ideally is so important. It's why I went into primary care. It's why I still practice primary care despite a lot of these challenges we talked about. Because when I have a patient like yourself who we've spent years kind of building that relationship and that trust. That's really, I mean, that's something special. And it's not so much that, oh, I've spent years learning about your complex illness and it took us all these years to find the zebra. It's more about that, how do I put it? I think it's that bond that you have
For sure.
with a patient. When I know your family, I know on any given month when I talk to you, I can tell within a minute of the call, I can tell, all right, is she having a bad week? Are we having a lot of migraines? Or we have it, I can kind of tell, and I can look back at my notes. I can look back at my notes for the past however many years and reference that and see the longitudinal progression over time. And so that doesn't happen overnight. And I think when you have doctors and providers that are kind of in and out of the system, where they're leaving early, or, that it's really hard to replace that. I mean, it's hard. You see when a doctor retires, and we had a doctor
Yeah.
retire from our practice a few years ago. He was retiring at a normal age, but when he left, a lot of his patients had to, be split up amongst those of us that were left. And what you just heard over and over from his patients was just how much like he felt like part of their family. They knew that they could confide in him anything. There wasn't anything too big or too small. He would ask them how their son's wedding was. He knew their pets' names. All that kind of stuff. It really matters, and primary care is unique in that. We're the only sort of part of medicine that has that. You think about cardiology, maybe you have a cardiologist that you see once a year, but at some point, typically you sort of graduate from specialty care if things are stable over years, or maybe you see them long term, but it's not quite the same as seeing them 2, 3, 12 times a year,
Yeah.
like you do with your primary care doctor.
Yeah. And it's not uncommon if I'm having a televisit with you that Tom will pop in, or one of
Yeah.
my kids will pop in and
Yes.
say, "Hey, Dr. Hadorn, how are you doing?" So,
Yeah, it's always nice
yeah.
to see them.
So before we let you go, if there's one message you'd like every listener to remember about today's conversation, what would that be? And I want to say that we did not get to talk about mental health today because we're running out of time. I'm hoping you'll agree to come back so that we can talk and
Yeah.
have a whole episode on mental health. So
Yeah,
I'm going to put you on the spot for that.
Yeah, not a problem. Yes, and I agree. I would love to have more discussion because that's such a huge part of my practice, any primary care practice these days. But I think a message, a takeaway would just be to, trust your primary care doctor. Remember that we're on your side and that we have your best interests at heart. And I think come to us for before seeking out outside information, or if it seems too good to be true, it probably is. That's what we're in it for. And so I think I love what I do. I wouldn't trade it for the world, but it's challenging, and the thing that keeps me coming back are those relationships. So I think just reminding people that every one of us is a patient at some point. I'm a patient. I have a primary care doctor, and so it's just trust us, and
Yeah.
it goes both ways.
I hope our listeners have found as much value in this conversation as I have. And I think we could sit and talk for another hour about mental health and about more about AI and the future of healthcare and the need for universal healthcare in our country. So thank you for everything that you've provided today.
Yeah, we
Yeah.
definitely need to have you back. And I cannot say this enough. Everyone needs a doctor like you.
No.
I'm serious. I talk about you all the time to Monica, and she
does.
Yeah, I do.
You're
And
very kind.
yeah, well, that is the truth. I mean, I've had to trust you in some pretty low periods of my life. At times where I've been emotionally vulnerable and frustrated and hopeless. And you've just kind of been a rock to kind of like get me through this and get my family through this, not just me, because my family's had to deal with what's happened to me over the past few years too. So I really hope that people can find someone like you in their community that they can go to and who provides for them what you have given me and my family. So I just want to say thank you.
Well, you're welcome, and thank you for the kind words. And you are the reason why I do what I do, and I appreciate you guys having me on, and hopefully we can continue the conversation.
Yeah, well, you're definitely coming back. So
Sounds good.
We'd like that. Yeah.
Sounds like an invite.
yay.
It is.
All right. Thank you, guys.
Thank you. And to our listeners, if you're finding meaning in the stories we're sharing, if something moves you, challenges you, makes you see the world a little differently, please like, comment, and share. It helps more than you know.
And follow us everywhere at The Politics Chicks on Substack, Threads, Blue Sky, Instagram, TikTok, and Facebook.
Thanks for being a part of our community, and keep shining your light so we can find each other in the dark.
And remember, we're stronger together. Thank you, Dr. Hadorn. I'll see you on
Thank you.
Wednesday. We have an
Thanks,
appointment on
guys.
Wednesday.
Bye-bye.
Bye-bye.